Assalamualaikum and good day everyone. My name is Norzihan Ayub and I'm from Faculty of Psychology and Social Work, University Malaysia Sabah. Today I'm pleased to present this study on behalf of myself and my co-authors. The topic of my presentation is the influence of social support on psychological adjustment among juveniles. In this presentation, I will briefly discuss the introduction of the study, the research objective, methodology, key findings, discussion, the implication and limitation of the study. So let me begin with the background of the study. Uh, Adolescence constitute a critical developmental phase characterized by extensive physical, cognitive, emotional, and social transformations. And according to Erickson, he described adolescence as an identity crisis, a time of fragmentation and conflict. During this period, adolescents face risk factors that can elevate their delinquent behavior, from truancy and vandalism to theft, drug abuse, and weapon possession. And the Home Minister of Malaysia stated that there were 5,633 juvenile cases recorded from 2023 to June 2025. And 2006 cases were recorded in 2023, followed by 2,442 cases in 2024 and 1,185 cases as of June 2025. This statistic shows a significant increase in juvenile cases. If these issues are not effectively addressed, juvenile cases may continue to increase over time. And upon institutionalization, adolescents are required to adapt to a highly structured rehabilitation environment. This adjustment often poses significant challenges for psychological adaptation and can affect their well-being. Adolescents in the juvenile justice system also demonstrate high level of anxiety, depression, post-traumatic stress disorder, and somatic problem. And previous research also argued that juvenile offenders face greater adjustment challenges than adults due to limited social skills and life experience. And therefore, social support is one of the elements that plays an important role in psychological adjustment among juveniles. Bender and friends, through their meta-analysis study, stated that emotional support, acceptance, and effective communication from family can promote adjustment and reduce distress. And another researcher also found that youths in residential care who had contact with collaborating families showed a better psychological adjustment. And the third researcher indicated that higher social support correlates with improved psychosocial adjustment, coping, and quality of life. There is notable lack of research examining social support and psychological adjustment specifically among juveniles in Malaysia. Therefore, the aim of this study is to examine the influence of social support on psychological adjustment among juveniles in Malaysia. And for research method, this study utilized a purposive sampling design, targeting a total of 140 juveniles from 3 correctional facilities in Malaysia. The participants aged between 15 to 21 years old. And there were two instruments that has been used in this study: multidimensional scale of perceived social support to evaluate individual perceptions of social support. This instrument comprises 12 items and employs a 7-point Likert scale, and the reliability was 0.7879. And the second instrument, when bigger adjustment inventory, was utilized to assess the emotional and behavioral adjustment of participants. This inventory consists 37 items that evaluate distress, restraint, and defensiveness dimensions. In this study, the reliability of 3 dimensions score ranging from 0.58 to 0.72. Analysis of data was carried out using SPSS version, and the data were analyzed using correlation and simple linear regression. And for the results, the section presents the socio-demographic characteristic of the participants, including gender, age, and level of education. As shown in the table, the majority of participants were male. The largest age group was 20 years old, while participant age 15 years old represented the smallest group. In terms of educational background, most participants had completed secondary education, whereas only a small proportion had complete pre-university education. And the next result showed that social support was negatively correlated with distress and positively correlated with restraint. The relationship with defensiveness was non-significant. This means that participants with higher social support tended to experience less distress and demonstrate better self-restraint. And next result, social support was a significant predictor of lower distress and higher restraint, but it was not a significant predictor of defensiveness. Overall, the findings suggest that other factors may also contribute to the psychological adjustment. And for discussion, the finding indicated that social support significantly influenced the distress and restraint dimension of psychological adjustment. A higher level of social support from family, friends, and others are associated with reduced distress and restraint. And these results are consistent with previous study that higher support from family, friends is associated with reduced psychological distress. And another previous study also stated that emotional, informational, and instrumental support through family, peer, and institutional relationship buffers against psychological distress. In addition, this study also consistent with McWay study that ongoing contact with biological parents and foster caregivers is linked to reduce symptoms such as aggressions and rule breaking. However, social support does not influence the defensiveness dimension. Defensiveness maybe reflects repressive coping patterns shaped before institutionalization. This was also consistent with importation deprivation framework posits that adjustment is jointly determined by pre-incarceration characteristic and institutional stress, that explaining why social support alone does not predict defensiveness. Importation theory posits that individuals arrive in correctional with their own distinct set of beliefs, trauma histories, family dysfunctions, pre-existing behaviors and experience which influence their adjustment to correctional setting. And deprivation theory also asserts that institutional conditions, including separation from family, restricted autonomy, and structured routines, introduce additional stress that impact their adaptation. There are few implications for this study. First, family need to maintain regular contact, engage in counseling and therapy, and participate in reintegration planning to reduce distress and strengthen self-regulation among the juveniles. And the second, mental health practitioners also play important role in conduct comprehensive assessment, telecognitive behavior therapy, and emotion regulation intervention to address distress, restraint, and defensive coping among the juveniles. And the third, correctional institution can integrate trauma-informed care, resilient building, coping skill training, and family-centered program into the rehabilitation curriculum program. And for study limitation, One of the limitations of our study is that the sample was drawn from only 3 locations, potentially limiting generalizability to the broader adolescent population. To resolve this limitation, subsequent studies should include a more varied and representative sample by recruiting adolescents from a range of regions and contexts. And beside that, include participants from varied cultural and socio-economic backgrounds and employ longitudinal designs to assess the adjustment trajectories over time. In conclusion, social support significantly influenced distress and restraint among juveniles, yet its non-significant effect on defensiveness underscore the multidimensional nature of psychological adjustment. And effective rehabilitation must integrate social support enhancement with trauma-informed care, emotion regulation training, and coping skills development to address the full spectrum of juvenile psychological needs. Thank you for your time and attention.